Hi, my name is Jenny Kwan. I'm the Member of Parliament for Vancouver East, and I'm bringing these closing comments to you from the unceded Coast Salish territories of the Musqueam, Squamish, and Tsleil-Waututh peoples. What we need to do now is to declare a national health emergency. We need to take on the opioid crisis the same way we did with the pandemic. We need to follow the evidence and the medical advice from Dr. Bonnie Henry. We need to decriminalize for personal use. We need to provide safe supply. We need to provide supports for people who are faced with addiction. Our first priority is got to be saving lives. That's what we can do, and that's what we must do.
We must engage adolescents and young adults in the discussion. We must provide youth with appropriate programs that are tailored to their needs and preferences, connect them to services that are welcoming and cohesive, and equip them with first-line treatment options that are evidence-based and aligned with their goals. Youth must be given a seat at the table. For far too long, mental health and substance use disorders among youth have been brushed aside, and this has to change immediately.
We need to start thinking about how to better deliver patient-centered care and what that really means for the patients. People who use substances are incredibly vulnerable, and when they decide to seek treatment, oftentimes there's very little to no choice available to them, and wait times are so long that we are constantly losing patients in our healthcare systems. Having a choice of treatment and timely access to that treatment is critical for increasing retention and lowering overdose rates.
Tackling overdose and overdose crisis requires the partnership with the community of people who inject drugs. It requires a comprehensive treatment approach with saturation levels of opiate agonist treatment across the prisons and community system, and it requires clear strategies to tackle fentanyl adulteration and high-level provision of naloxone.
So what do I think is the next step in ending the overdose crisis? I think it's to legalize all drugs in Canada, provide that path to create a regulated market, allow for quality control of these substances, ensure that these substances aren't being contaminated with other substances like fentanyl or carfentanil, and provide that knowledge to the person using the substance so that they can make an informed decision about their use and ensure that they're getting proper dosage.
My name is Michael Krause. I'm the UBC Providence Leadership Chair for Addiction Research. The current overdose crisis is the biggest public health threat for people using psychotropic substances and mentally ill, far worse than the suicide epidemic and other problems we see. In order to address it, we need to learn. We need to learn from good examples in other countries. We need to reorganize our healthcare system and especially make our mental health and substance use services an integrated response to the current catastrophe. That is a priority, and we need to mobilize the best resources and the best assets in order to be able to stop that. It is stoppable, but it needs a significant increase in attention and resources. It's not going away. We will see a lot of victims. We need to stop that.